Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center. We're going to be doing case number 01941. This is a 6-year-old terrier with allergies. So allergies are important when we're looking at, is it an allergen or is there a sensitivity? In this case we're looking at allergies, but if we think about allergies in terms of what they are, allergens are sensitivities that are incorporated into the lymphatic system, and it causes continual inflammation even though we're not exposed to the sensitivity anymore. But if we are, it can manifest as a much higher and more intense inflammation. And so because we do have allergy weakness, we want to correct that to try to purge out any allergens in the system. On the other side, we're looking at the skin, spleen, thyroid, the pituitary, and the heart. And so stress can lead to further manifestation of inflammation, especially if the thyroid is involved and the pituitary, because the response to fight or flight in the body, in this case inflammation, can be much more intensified, or immune system can't clear it out. And so 3 months of, I'm going to use a hemp oil infusion, 3 drops a day to do this correction. And in 3 months we're going to see these numbers resolved. We may see others in the green here that could be in transition, but typically the numbers that are off balance right now go back to normal. So let's look at the sensitivities. Since we have allergies, we want to be sure we're not exposed to these sensitivities. So if we look at on the base point reading, we can see by screening by group here that we have food. We come down and we see that, go to the next page, we see additives, specifically fruit, these two things. Additives are typically going to be products in either exposure to our foods that are processed, or they could have preservatives in the dog food, so we want to make sure that none of those on the list, if you look through that, that we're being exposed to. The other thing is fruit. Sometimes we don't always give fruit, but at the same time in the warm weather, if we give a piece of watermelon or a piece of apple, a pear, then we want to be sure that that's not on the sensitivity list. Since we've seen a wide area or a wide number of fruit that was on the list, we want to be careful of any fruit that we give. Check the diet too, because a lot of the holistic diets do have fruit in it, so we want to make sure that we're not getting any kind of fruit in the diet. And so sensitivities are usually exposure short term, so as long as we're not getting these items, we shouldn't have to worry about inflammation from those. In the 3-month window, we want to be sure that we're controlling symptoms as much as possible without using a lot of corticosteroids in the process, because the more steroids we use, unfortunately, the longer the allergies take to clear. So short term, we want to use antihistamines or an anti-inflammatory to control intensity, keep it between 1 and 5 versus 5 to 10 on the intensity scale. We want to use B12 and also consider cold laser therapy to control internal symptoms that are related to allergy release, and then finally we want to do the hemp oil infusion. So check the video, take some time to review it, look at the copy that you receive of the test results, and then formulate questions, because the next step is we want to talk about what makes sense, what doesn't make sense, because we want this to fit with and make it easy for you to take care of. So give us a call at 847-541-4005 if you have questions, and we'll get set up a consult for you.